Hi, thank you for joining us. My name is Dana Cooper, and I'm the Executive Director for the Nurse Practitioners Association of Ontario, or NPAO. We are celebrating nurse practitioners in Ontario and the wide-ranging and valuable contributions they make to healthcare every single day by meeting some of those nurse practitioners and getting an introduction to what they do. Today, we are talking with Carole Gionet. Carole is the chair of the NPAO Mental Health and Addictions Community of Practice. Welcome, Carole.
Thank you for having me.
Carole, why don't we start by you providing a brief description of yourself, your years of experience, and current work?
So I started my career as a public health nurse in sexual health in York Region, and actually that job was the one that spurred me on to become a nurse practitioner. It was a great job where I was able to work in an expanded role, diagnosing various sexually transmitted infections and prescribing medications under medical directives. And that made me feel that I wanted to be more autonomous. And at the time, don't want to age myself, but they started the NP education in Ontario. I think it was the NDP government that spurred that on. And so I got into the second cohort, and that's where I am today. I then proceeded to work in community health centers, and there I realized there was a real gap in services for mental health. And through my journey through the CHCs and also managing a health center at a college, I realized that many people in Ontario were not being assessed appropriate for mental illness and suffering in silence, not getting treatment. And then that led me to my job at Ontario Shores as a nurse practitioner in the adolescent program. So currently I do assessments and provide treatment for young people with mental illness.
Excellent. Wow. Yeah, it must be an incredible world you work within. Tell me about the mental health and addictions community of practice. What do you hope to achieve? And
we've only had a couple of meetings, but hoping to really galvanize the NP community who's working in mental health. When I first started Ontario Shores, there's really only 2 NPs that I knew of that were working in the specialty. Now that we've grown to, I think there's more than 50, hundreds of NPs working in mental health. So I'm hoping that with the help of NPAO, we can be more political. Also, education is huge. There really isn't, other than U of T's developed a program right now. I had to learn all my knowledge from the psychiatrist, taking different workshops. There's nothing, there wasn't enough in the NP program. There could be more now. I remember sitting in a room doing about an hour or 2 hours on depression and anxiety. When 1 in 5 young people have, or adults have mental illness, we need to be screening them in the primary care setting. So I'm hoping that with our community practice, we can raise awareness about the important role of NPs in mental health. As well as there's also NPs in the group who are having a hard time getting funding from insurance companies and do therapy. They've been trained in DBT, and there's a real lack of services in terms of therapy. And some of these therapies are life-saving. So I'm hoping our group can help with help in educating the public, getting more recognition of the important work that NPs do in mental health.
well, you mentioned a couple of things there. Number one, diagnosis in primary care, which is where we find a lot of nurse practitioners, of course.
Yeah.
So it's an important role there. The recognition of the nurse practitioner's scope and capabilities in this space certainly needs to increase in terms of the funders, and the policymakers. So, mental health and addictions continues to grow in our population. What are the causes of this growth rate? Why are we seeing this escalate?
Oh boy. There's many factors. For one, with the young people, what I notice is social media. Look at Facebook, and to show that there's a lot of pressures for young people. That's what I'm finding is the there's bullying, there's the social media, they can't get away from it. They're linking to sites that encourage things like eating disorders, suicidality. It's all magnified, and I call it the rabbit hole of social media. I think that's a role. Also, I've noticed a huge increase in the numbers of clients we're seeing. We're actually seeing a lot of young people too. I don't know what the factor is, but on top of their comorbid mental illness, they have developed eating disorders during this time. I'm not sure what the factor is, whether it's a sense of if I can control what I eat, and maybe that controls the uncertainty of the pandemic. I'm just thinking outside the box. I just think there's more pressures in society now than there was 20 years ago.
So we really need to be on our game in regards to mental health and addictions.
Yeah.
Yeah, everybody needs to step up. So can you explain a bit about what is the nurse practitioner's scope of practice as it pertains to mental health and addictions?
Yes, so we have the ability to do, provided that we have the training to make a diagnosis and treat depression, anxiety, just like any of the other conditions. But what was lacking when I was going through the program was the education. I've had to develop it over. I've had to acquire that knowledge through help through the psychiatrists and taking courses. U of T just, and we're part of this program, they have a certificate now. And I'm hoping that will branch to more education for NPs. So certainly in the primary care role, we should be able to screen for depression and anxiety and treat it, and then make referrals as appropriate if the client is not improving with the treatment plan that you're providing.
It's another great example of the wide range of capabilities of nurse practitioners, for sure. So in the past year, there's been some funding announcements from federal, provincial governments for mental health and addictions. How do you think that funding should be used for the greatest impact?
That's a good question. I think it needs to go to different areas, but definitely in the primary care, setting, there needs to be funding there. They say that, a client, research shows that someone who commits suicide has seen their primary care provider at least 6 times. So there are 6 opportunities that primary care provider could have intervened and possibly could have prevented a tragic event. So definitely, I think it needs to go in the primary care setting around educating NPs, all primary care providers. I get a lot, it's interesting enough, I get a lot of clients at Ontario Shores where a physician could have treated that young person, but they don't feel that they have the skills. And so they refer them back to us, and then we give them instructions on how to prescribe an SSRI. So it needs to, and they definitely have the scope of practice. They're just not comfortable because the medications are prescribed off-label in Canada due to the black box warnings for suicidality. So I do think a lot of the funding needs to go into primary care and training primary care professionals to be that first line. The money, I think, would go a long way, as opposed to referring to psychiatry or to us. We should really be dealing with the more complicated mental health cases, and it actually get care at a more quicker rate. Right now, clients are waiting 2 to 3 months for a psychiatric assessment when they could be treated by a trained professional in the primary care setting.
Right. Well, I think, as we know.
Sorry. Oh my God. I'm sorry.
No worries. No worries.
The other thing too is therapy. So for example, young people with borderline personality disorder require a specialized DBT therapy. I'm sorry. DBT therapy, and our wait times right now for therapy are 1 to 2 years for deep And these are clients with suicidality. And so they're waiting 2 years for what I call is life-saving therapy. So funding needs to go. We do have the research to support that DBT and CBT does work. So our governments need to be funding therapy.
We got it on
Is that
both
your dog?
Yeah.
Okay.
Well, like as you pointed out, Carol, this is a hugely important area that needs attention. It continues to grow in our society. I do know there's a great number of nurse practitioners working in this space because of the need. And it's again another example as to the value that nurse practitioners can provide to that continuum of care here in Ontario. I really do want to thank you for taking the time this morning and for highlighting the work of nurse practitioners in mental health and addictions. And again, yet another area where nurse practitioners contribute their knowledge and skills and through their compassionate and holistic approach to care, which is perfectly suited for the work of this patient cohort for sure. One last thing, Carol, seeing as we're celebrating nurse practitioners, what makes you proud to be a nurse practitioner?
Just, it may be as simple as a family saying to me, you're the first professional I've seen for mental health that's really listened to me and has given me hope. It's what I give to my clients that makes me proud to be an NP. It's just as simple as that. It's very gratifying, and I see that NPs can really, in terms of mental health, fill the gaps in services that occur right now. So, and having that autonomy as well.
Yeah. Excellent. Well, thank you again. That's Carole Gionet. She's the co-chair. Do you have a co-chair?
No, I don't.
Not at the moment.
I
Chair of the
I may look at
Mental Health and Addictions Community of Practice here at NPAO. Thank you so much for taking the time. Happy Nurse Practitioners Week.
Yes, thank you, Dana. I appreciate
continued
all
good
the
work.
work you guys do for us too.
Thanks, Carol. Take care.
Bye-bye.